Welcome to Chapter 5, Medical Terminology. So as you progress through EMT training, one of the most important tools you'll develop is the ability to communicate clearly and accurately in a language of medicine, right? This specialized language isn't just about sounding professional, it's really about ensuring that you can share precise information under duress, under pressure, and often in these life or death type situations. So in this PowerPoint, in this presentation, we're really going to explore the structure of medical terminology, medical terms, how they're formed, how they break down, and then how are they used in documentation and verbal reports. You're also going to learn how prefixes, roots, suffixes work together to convey meaning, and just how symbols and abbreviations through shorthand must be used correctly to avoid confusion. So this chapter is going to really give you the tools to decode medical terminology confidently, so you can perform your role both effectively and professionally. With that being said, let's go ahead and move forward to the National EMS competencies that really guides this content. So medical terminology, okay, this is an essential part of your EMS foundation. The National EMS Education Standards really emphasizes that EMTs must demonstrate competence in using medical terms and abbreviations during both written documentation and verbal communication. This really includes interactions with healthcare professionals at every single level, whether that's the dispatchers all the way to the ER physicians. But let's be clear, this isn't about memorizing long medical words. It's about learning how to use terms correctly and consistently in your reports, in your patient handoffs, and with radio communications. So when you say a patient is presenting with tachypnea or hypotension, those around you instantly know that the patient is breathing rapidly and has low blood pressure. No ambiguity, no wasted time. It's really just effective professional communication. So as we move through this chapter, we'll break down the rules of terminology so you'll know how to use it, and just as importantly, how to understand it when it's used by others. So let's start by diving into the introduction, right? The function of an effective EMT, or to function as an effective EMT, you need to have working knowledge of medical terminology. These terms form the foundation of your daily language in the field. So whether you're writing a patient care report, giving, again, the hospital handoff, or participating in an MCI situation, it's clear and consistent use of medical terminology. It keeps the team aligned and it improves patient outcomes, okay? There are three key elements you'll focus on in this chapter. We have medical terms, abbreviations, and symbols, okay? These are used throughout your entire career to streamline communication, reduce documentation time, and above all else, ensure clarity, okay? It's really important to know when and how to use them. What works in a professional setting doesn't always work with patients, though. Who may find medical jargon confusing or even frightening. So for instance, instead of telling a patient they have, epigastric tenderness, you might say, hey, it's a little sore in the upper part of the stomach, right? Remember, clarity with your team is the most important thing, but compassion with your patient. So now let's move on into the second part of the introduction, where we're really going to explore how understanding word parts can help you decode unfamiliar terms, right? So one of the more empowering parts of learning medical terminology is that it enables you to decipher words that you've really never heard before. You'll be able to do this by understanding the individual parts of a word. A term might seem complex, when you first look at it, but if you know the meaning of its components, like the prefix, the word root, and the suffix, you can really figure out what it is relatively quickly. For example, the word hypoglycemia. So it might sound intimidating when, since this is like a first time you're really hearing these words, but once you know that hypo, so the prefix hypo means low, glycic means, is referring to, as the word root refers to sugar, and emia, which is going to be the suffix, means a condition of the blood. So you can determine that the term means low blood sugar. Okay, so this analytical skill will allow you to understand the clinical language in reports, recognize patterns in patient conditions, communicate more clearly and confidently. Understanding medical jargon doesn't just make you sound smarter, it really makes you more effective. It builds trust with medical professionals, adds clarity to your reports, and it helps prevent dangerous misunderstandings in the field. So now let's go ahead and look at the actual anatomy of a medical term and how each component plays a specific role in giving the meaning to the whole. So let's kind of jump right into it. So breaking down how these medical terms are actually constructed, all right? Medical terms, they're not random. They're made of distinct parts, each of which have a specific function, okay? Think of a medical term like a recipe, okay? So each ingredient, the prefix, the word root, the suffix, and sometimes a combining vowel, which we'll talk about, it contributes to the overall meaning. And just like in cooking, if you leave something out or swap the wrong part, it's completely changes the results, and in this situation, the meaning of the word. So changing or deleting even a single component of a medical word can dramatically alter its meaning. So take the word, this is a common example, take the word dysphagia and dysphagia. As an example. So they sound extremely similar, but they refer to two entirely different conditions. Difficulty speaking versus difficulty swallowing. So in an emergency setting, confusing the two could lead to a dangerous misunderstanding. That's why spelling in this situation really matters, okay? Pronunciation matters. And understanding the function of each part of the term, what it contributes to the meaning, it just matters so much. In this section, we're going to be exploring how each of these components in detail, so each one of them and like what they actually mean, starting with the building blocks of every medical term, okay? So next, let's go ahead and look at what exactly makes up a medical term and how these components actually work together, okay? So now that you have a basic grasp of what medical terms are, let's break down those components one by one, okay? As I talked about, the four primary parts of a medical term are the word root, the prefix, the suffix, and the combining vowel. The word root is the core of the word. So it really carries the fundamental meaning and usually refers to a body part or a system. For example, cardi refers to the heart, and nerve is going to refer to nerves, okay? Then we have a prefix. So this comes at the beginning of a term and usually describes a location, intensity, maybe time, or a number, okay? It's going to modify the meaning of the word root. For instance, Brady means slow, while tacky means fast, and those are both prefixes. So when we pair that with peña, for example, which means breathing, we're going to get bradypnea or tachypnea. Okay, so that means either breathing too slow or breathing fast. Now let's look at the suffix, okay? So appearing at the end, the suffix often tells us a procedure, a condition, maybe a disease. The suffix, for example, itis, okay, very common, indicates inflammation. So as in like an example, arthritis, okay? So arth is gonna be a word group referring to a joint. So arthritis is when you combine it all, is inflammation of a joint. Lastly, we have a combining vowel, okay? So typically an O, right? So this vowel is really used to connect word parts, especially when the suffix or the next root begins with a consonant, okay? So for example, so like we're looking at gastroenterology, Okay, so that's going to join gaster, which is stomach, and enter, which is intestines, with the suffix logy, which is the study of. So knowing these four components and their rules, allow you to deconstruct nearly any medical term you'll encounter. So this isn't just about, again, memorizing the words. It's about learning a system that makes those words really accessible to you. Next, we're going to go ahead and explore how the combination of these parts form the actual meaning of a term and why getting them right is so critical to having accurate communication. And now that you're familiar with the four building blocks of a medical term, again, I'm going to keep re-emphasizing this: the word root, prefix, suffix, combining vowel. It's really time to understand how these parts are combined to form meaning, okay? So this process is where accuracy becomes essential, okay? The arrangement of word parts in a term, it isn't random, okay? So it follows specific rules that determine the term's meaning. For example, the prefix gives context, like the direction, the quantity, or absence. The root tells us what part of the body or system we're talking about. The suffix completes the entire picture by telling us what's happening to the part of the body. Okay, and then lastly, again, the combining vowel is just really going to help us say it more clearly, and that's pretty much the only reason the combining vowel is there, is so it comes off your tongue more fluidly. Spelling is equally as important as pronunciation. Okay, so many terms are pronounced similarly but mean completely different things. So take the terms like we talked about in the beginning: dysphagia with an S and dysphagia, okay, which with a G. So this is going to refer to eating or swallowing. So phagia with an S refers to speaking. Phagia with a G is referring to eating or swallowing. And then the prefix dis is meaning difficult or abnormal. And you get two very different conditions from this. You have difficulty speaking versus difficulty swallowing. So imagine really the consequences of confusing those terms in your report or during a hospital handoff. Another example is ilium and ilium, right? It sound very, very similar, but one has an E, the other one just has another I. So it's I-L-E-U-M, I-L-I-U-M. So run refers to the final portion of the small intestines, and the other is referring to the upper part of the hip bone. Okay? They sound identical, but the context and spelling tells us exactly what structure we're going to deal with. So what's the takeaway, right? So the structure of a medical term gives us the meaning, okay? And even a small change can cause a major error. So as we continue, pay close attention not only to what each part means, but also how it all fits in to the term as a whole. Next, we're going to continue on with the idea by looking at how the knowledge of anatomy and context really helps refine our interpretation of these terms. So we just discussed how the structure of medical terms determines their meaning. But equally important is understanding the context in which those terms are used. So that's what really this slide focuses on, is recognizing that the same word part can mean different things, really depending on the body systems or the clinical situation. Let's take the term cardiomegaly. Okay, it combines cardio, which refers to heart, and megaly, which refers to enlargement. Okay, so from the word structure alone, we know that this means an enlarged heart. But really, to fully understand its significance, you need to consider where the term is appearing. Is the enlargement due to chronic hypertension? Is it associated with heart failure? The context really helps translate the term from a real sterile definition into a real-world meaning that informs your overall care of the patient. So this is why your growing knowledge of anatomy and physiology, it really matters so much. So the more you understand the systems and the structures of the body, the more quickly and like accurately you're going to be able to interpret the terms like in the moment. Okay. For example, hearing the term hepatic in a medical report, this immediately tells you it's some type of discussion involving the liver, because what you've learned, hepat refers to liver tissue. So while the word part gives you the basic translation, it's your medical education that's really going to bring depth and nuance. In EMS, especially as an EMT or paramedic, you often don't have time to look things up, okay? That's why we train you to use both word structure and clinical context to make split-second decisions that are both safe and effective. So now let's go ahead and dive into the individual word parts, okay? We're going to start with the word root, which is really the foundation of every medical term. So this is really the fundamental part of medical terms, okay? So you can think of it as like the backbone, okay? The part that provides the essential meaning. Most often, the word root will refer to a body part, an organ, or a body system. For example, cardi means heart. Ner refers to nerves. Gaster means stomach, and osti is referring to bone. So the word root really anchors the entire term. It's the first clue really you'll use to understand what the term is referring to, especially when time is short and accuracy is so vastly important. Most medical terms contain at least one word root, and some will contain two or more, particularly when describing conditions involving multiple body systems. A very common one is gastroenteritis. Okay, so in gastroenteritis, for instance, gaster refers to the stomach. Enter is referring to intestines, and itis is referring to inflammation. So when we put that together, the term tells us we're talking about inflammation of both the stomach and the intestines. So because so many medical words share common roots, learning these will give you really a massive advantage. Recognizing the root allows you to decode unfamiliar terms both quickly and confidently, which is really important when you're reading patients' records, listening to handoffs, or just documenting your own assessment. So with that in mind, we're going to go ahead and move on into different word roots, and then how they can combine with different prefixes and suffixes, and how even just one little change can lead to an entirely different meaning. So again, let's look at the prefixes and suffixes and how they are combined to a word root to create a full medical term. So how any type of addition or subtraction of the prefix or suffix can have a drastic change on the overall context and definition of the term. So a word root, again, on its own, tells us what part of the body or system we're dealing with. Okay, but by adding a prefix to the beginning and a suffix to the end, we're going to define what, where, and what's happening. So think of the word root as the subject, and the prefix and suffix as kind of like the setting and the action. So let's break down a real-world example that you're going to hear often as an EMT. Cardiopulmonary, okay? So cardio, again, refers to the heart, okay? So that's going to be the word root. But then you also have pulmon, which refers to lungs, which is also a word root. The term combines these two, describing something that relates to both the heart and the lungs, as cardiopulmonary resuscitation, or CPR. So when we perform CPR, we're using compressions to circulate blood from the heart and ventilations to move air into the lungs. So the term cardiopulmonary tells us exactly what systems are involved. Now imagine changing just one prefix or suffix, and it's going to alter the meaning completely. So let's say we add myo, so the prefix the word root myo to cardial, okay, and then you're going to get myocardial. Okay, this is going to refer to muscle of the heart. And then if we add the suffix itis, now we get myocarditis, which is inflammation of heart muscle. Okay, So really by mastering these building blocks, you'll be able to understand what's going on inside the patient's body just by really hearing or seeing the term. It's like having a map, right, to the entire human body encoded in the words that we use. Now, with that in mind, let's go ahead and shift our focus to specifically to the beginning of the term. So we're going to focus just on the prefix and look at and see how it really sets the stage for the meaning of this medical language. So again, the prefix starts at the beginning of the term. Okay, it gives added detail to the root, modifying the details, modifying the meaning of modifying the meaning by indicating the location, the number, the time, the intensity, or just the status. Okay, so for an EMT, prefixes are especially important because they often indicate the urgency or severity of a specific condition. So take the root pena, which means breathing. So by adding different prefixes, you can entirely change the representation of the clinical situation that you're in. For example, adding the prefix a or a to pena, so apnea, that means no breathing. So a means without, so without breaths, without breathing, so no breathing. Bradypnea, that's going to refer to slow breathing, as in Brady means slow, added to pena, of breathing. Then we have on the opposite side tachypnea or tachypnea. That is rapid breathing, okay? So because tachy is referring to fast. So even though the root pena stays the same, the meaning of the term changes drastically with each of the different prefixes that we apply to it. And so does your treatment based on the specific term. So prefixes are also commonly used to describe locations. So for example, sub. Sub means under, as in subcutaneous, so that's under the skin. Inter means between, as in intercostal, between the ribs. We have pre means before, as in prenatal, so that's before birth. So you'll also see prefixes describe quantity. Okay, so like uni, that means one. Bi means two. Multi means many. So understanding these prefixes give you the first clue to the meaning of a medical term. They help you paint a complete picture rapidly. And in EMS, fast matters. So fast and accuracy matters. Coming up next, let's go ahead and look into the suffixes. So at the end of the word root, it's going to tell us what's happening to that body or that body system. So again, this is going to be the part that comes at the end, the suffix. The suffix is often the most diagnostic portion of the medical term because it really describes what's happening in the body part of the identified word root. So in other words, the suffix tells us whether we're talking about a condition, maybe a procedure or a disease, or even just a part of speech. So let's go ahead and look into some of the common ones you're going to encounter. One of the most common is going to be the suffix itis, okay? And that refers to inflammation. An example would be arthritis. So arth is referring to joints. So when you add that suffix to it, arthritis, it's inflammation of the joint. We could look at emia. So emia is referencing condition of the blood. So an example of anemia with the prefix a deficiency of red blood cells. Okay. We also have algia, which is pain. Neuralgia is nerve pain. Ectomy refers to surgical removal. So if we add appendectomy, is removal of the appendix. Okay. Another common one is pathy, which refers to disease. So an example, neuropathy, is disease of the nerves. Okay, so a suffix may also change the term into a noun or an adjective, right? Which is especially important when describing findings in your report. An example of this would be hypoxic. So with the suffix IC, it means pertaining to low oxygen levels. Okay, while hypoxia with the IA is the actual condition itself. So knowing the suffixes allows you to really interpret what kind of issue is being described, whether it's pain, inflammation, degeneration, disease, or removal. Okay, so this is really a critical part when reviewing hospital documents, calling in reports, writing patient care reports, because these, especially PCRs, because those are going to be read by physicians and other healthcare providers. So we want to make sure we're using the universal language in the medical field. So now let's kind of look at, it's going to be a little change of pace, and we're going to talk about combining vowels, okay? So a combining vowel is going to help connect word parts so they're essentially easier to pronounce. So while it doesn't change the meaning of the word, including a combining vowel, the combining vowel really makes the term just easier to say, and it's incredibly important when you're under pressure and need to communicate quickly and clearly that it's something that can be pronounced relatively simply. So most often combining the vowel is the letter O, okay? Though sometimes you will see the I or the E, but its primary function simply is to connect a word root to a suffix, okay? And this is especially true when the suffix begins with a consonant, okay? Or when you're trying to connect two word roots in a compound term. So really without the combining vowel, the term may be difficult to pronounce or just feel awkward to say. So for example, and it's a little bit easier when you're actually reading it, but let's look at gastrology. So you have gaster, combining vowel of O, and logy, okay? So gaster refers to the stomach, logy refers to the study of. So the combining vowel is O, so gastroenterology, the study of stomachs and intestines. So if you didn't have that, again, it would just be gastrology. So it's kind of, there's like a big break right in the middle. Another example is cardiopulmonary, which we just talked about. Cardi refers to heart. Pulmon is lungs. Airy is pertaining to, with a combining vowel of O between the roots. So the results is pertain to the heart and lungs. So if you notice that the O kind of acts like a bridge or a glue that binds the terms together smoothly. If we just simply removed it, it'd be cardiopulmonary, so not cardiopulmonary. So it just runs off the tongue so much smoother with that combining vowel. So in EMS, where miscommunication can cost precious time, it's really important that clarity is of the utmost importance. Also note, you don't use combining vowels if the suffix already begins with a vowel. So you won't say cardioitis, okay? You just say carditis. Okay, by understanding the role of the combining vowel, you're really completing your foundation in medical term construction. So now you know how all the parts, okay? So we've covered like the prefixes, the word roots, the suffixes, and now the combining vowel. And you know how they fit together to form a language that is universal in the medical field. It's efficient, it's very descriptive, and really it's clinically essential. So now let's kind of look at actually the rules of word building, okay? So we're going to take all of that and kind of see the functions of it in real time. So these guidelines will really help you understand how the combining prefixes, the roots, the suffixes, and really the combining vowels, how do you like bind them together, okay, to ensure that your terms are both accurate and pronounceable, okay? So here are the basic rules. So number one, the prefix always comes at the beginning of the term, right? So, but not every word root or term will have a prefix. So when it's present, it modifies the meaning of the word root by adding a location, a quantity, or a condition. Okay. An example, Brady. So in bradycardia, slow heart rate. Number two, the suffix is always at the end. And it's often the key to understanding the condition or the procedure, right? And again, itis is going to be the best example. So for example, tonsillitis, right? It means inflammation, okay? In this specific case, inflammation of the tonsils. Number 3, use a combining vowel when the suffix begins with a consonant. This makes the word easier to pronounce. So, and we just covered this, but arthroscopy. Okay, arthur refers to the joints, and then oscopy. Okay, arthroscopy. Number 4, using a combining vowel between two word roots. So even if the second root starts with a vowel, this really helps smooth out the transition between the two body systems, okay, or the structures. And again, just like gastroenterology, you're going to connect gaster in the stomach and enter from the intestines using the O. Lastly, do not use a combining vowel if the suffix begins with a vowel, okay? So again, gastritis, not gastroitis. Applying these rules will help build terms from scratch and decode unfamiliar ones relatively quickly. You'll also avoid the kinds of awkward or incorrect constructions that can make documentation and communication very unclear, and at worst, it could be dangerous. So, now that we kind of know how to build the words, we understand the different individual parts, let's kind of take a look at plural endings, okay? So a plural ending is crucial for clear communication, especially when you're documenting or reporting. In everyday language, making a word plural is simple. You just add an S, right? But in medical terminology, the rules kind of vary depending on how the word ends. Using the correct form helps maintain both accuracy and professionalism. For example, take the word lung. To make it plural, you simply add an S. Lungs. But with many Greek or medical, with many medical terms, it's founded in Greek or Latin origins. So there are different rules that will apply. So some of the common ones you're going to see, if a word ends in A, okay, so it ends in an A, you're going to change it to an AE. So instead of it being, and this is again when you're making it plural. So a vertebra is singular, and it becomes vertebrae, which is multiples, okay? If it ends in is or is, you're going to change it to S. So a diagnosis versus diagnoses, okay? Words ending in EX or IX change to ICES. So apex to a Pisces or a Pisces. Words that end in on or so on or become a. So ganglion becomes ganglia. Ovum becomes ova. If the word ends in us, you're going to change it to I. So bronchus becomes bronchi. You might also see it as bronchi, but either one's fine. So these changes, they're really minor, but using the incorrect plural form, it can lead to confusions, especially when multiple structures, when it involves multiple structures or findings. So for example, saying vertebrus instead of vertebrae might be misunderstood, but it's not clinically accurate, and it can make your documentation look very unprofessional. So while we may feel like a small detail, like this is just a small detail, mastering these plural endings will again help you sound more competent and communicate more clearly. So whether you're writing a patient care report, reading hospital documentation, or reviewing case studies. So now that you understand that, again, let's keep it on moving. And we're going to talk about some special word parts that are going to describe colors, numbers, and positions. These are going to be very key concepts that will really enhance your ability to describe findings with just overall precision. So once again, in addition to the roots, the prefixes, the suffixes, and combining vowels, there are certain special words, okay, that you'll frequently encounter in EMS terminology. These special components help us describe numbers, colors, and anatomical positions or directions. So they enhance the specificity of our language, okay, and allows us to give clear, concise descriptions of patients' conditions and their assessments. So let's start by understanding their purpose, okay? So these word parts are primarily prefixes or roots, and when added to a term, they provide important qualifiers. For example, when we use a prefix that describes a number, okay, we can indicate whether a condition involves one part of the body or multiple parts of the body. when using a prefix that describes color. We can give you vital clues about the patient's appearance, specifically such as like cyanosis or jaundice, okay? And when describing position or direction, these terms help us identify exactly where an injury is located or simply how pain may be radiating or moving in the body. So the section of this chapter really breaks down these categories into digestible lists so you can learn to recognize and apply them easily. So by incorporating these descriptors into your terminology, you'll sound more precise in your radio reports, your PCRs, and really your handoffs with the hospital staff. So now let's go ahead and move on to number-related word parts. Okay, so these are going to be common in both medical documentation and patient care discussions. Okay, so these word parts all allow us to indicate how many structures, how many sides or occurrences are involved, and they really help clarify the scope of a condition or procedure. For example, you might document whether something is happening on one side of the body or both sides of the body, or whether it's only affecting one system or multiple systems. Some of the more frequently used numeric preferences include uni, that means one, so like unilateral, which describes something affecting only one side of the body. Bi, meaning two, like bicuspid. This refers to a structure with two cusps or leaflets, and it's often used to reference the heart valve. And in that same breath, we have tri, meaning three, which you're going to hear in terms like tricuspid valve, which is another heart valve, but instead of having two leaflets, it has three leaflets. You also might see quandary, tetra, both of those mean four. Not as common, but you're still going to see them describe things like quadriceps muscles or tetraplegia. You have multi, and that's going to indicate many or multiples, like multifocal, which kind of refers to multiple areas of origins, especially when you're talking about seizures or infections. You have null, which means none. You might see this in terms of like nulliparous, describing a woman who has never given birth. There are also prefixes like primi, meaning first, and poly, which means many. Those are both like really often in the OBGYN type situations and medical history context. So understanding these numeric descriptors, they will help you quickly interpret conditions involved in single versus multiple systems or sides. And it's really essential when assessing trauma patients or describing neurological deficits. But with that being said, moving on, let's go ahead and get into back into like kind of the color related word parts. So these can be extremely useful as well during your assessment and documentation because color often provides really important visual cues about a patient's condition, especially when evaluating skin signs, bodily fluids, traumas. Recognizing these word parts will help you quickly be able to interpret medical terms and communicate observations more effectively. So some of the more common ones you're going to see, cyano, or it's like cyano with a combining vowel, is going to refer to the color blue. When we say a patient is cyanotic, we mean that they appear to have a bluish, like dew, like a color to their skin, and this is usually due to a lack of oxygenation. This can be often found around the lips, the eyes, and the nail beds and the fingers. You have leuco, which means white, and this is kind of referencing like a leukocyte, right? It refers to a white blood a white blood cell, which is important for the immune system for fighting infections. Erythro means red. You might hear this in erythemia, which describes redness of the skin, which is also an indication of like usually infection, irritation, or just inflammation. Melano refers to black or dark. It's used words like melanoma, which is a serious form of skin cancer involving dark pigmented lesions. Cero means yellowish and orange. This appears in terms like cirrhosis, referring to the liver disease that causes a yellow discoloration of the skin and the eyes. as an EMT, you're often you'll often describe patient findings in the terms of colors. So knowing these roots gives you, again, a leg up when reading clinical notes, understanding diagnosis diagnoses, or explaining your findings to ER staff. And overall professional. So, like, for example, instead of saying the patient looked pale, you might report that the patient exhibited pallor with cool and diaphragmatic skin. Okay, that's a part of your whole skin assessment. And it just shows a more professional and a higher level of clinical description. Okay, so now let's go ahead and shift into positional and directional word parts. So these are going to be very vital for EMTs for describing their injuries and like where they occurred, how the condition presents, or the direction in which the symptoms will radiate. Okay, these word parts allow us to really communicate specific locations on the body in a way that is universally understood by healthcare providers. And it's important to note whenever we're talking about directional terms and a patient's body, we always have to think about them in anatomical position. Okay, in anatomical position, it's just a reference position. You're gonna in your mind, you're gonna place the patient, and that is the patient is standing upright, feet or shoulder width apart, arms are down by their sides with the palms facing up. Okay, so that way, and that's going to be referenced by any medical provider. So when you're using directional terms, you're all using the same reference point. Okay, but let's go ahead and get into some of the more common terms you're going to see. For example, you're going to see a prefix of ab. This means away from. For example, abduction. Okay, we're going to cover this in lab a little bit more when we kind of go over the directional terms, but abduction refers to the movement of a limb away from the body's midline. Okay, where on the flip side, adduction means towards, as in movement of a limb towards the midline. You also have DE, which refers to something being down or away from normal, like dehydration from loss of water. Circum means around. You'll see this in like circumduction, which is like, again, arm movement in circles. Circummal cyanosis, which is bluish discoloration around the mouth. You'll see prefixes like peri, meaning surrounding or around, such as pericardium, which is the sac that surrounds the heart. You're going to see things like trans, meaning across or through, as in like transcutaneous, and that refers to something passing through the skin. Epi means above, seen in like epigastric pains, which is pain above the stomach. Supra also means above and can be found in supra pubic catheters, which is, again, just placed above the pubic bone. So like these prefixes can be very helpful for describing where on the body something is happening. So instead of saying the wound is on the front and slightly above the belly button, you'll use precise medical language, like the wound is in the epigastric region. So it's as simple as that. It sounds more clear, it's more professional, and it really ensures that the everyone involved in the patient care of that patient knows exactly what you mean. So now with that being said, again, let's go ahead and take all of these concepts of numbers, colors, and positions and start applying them to more directional and movement terms. Okay. So these common direction, movement, and position terms. So these terms you'll use constantly as an EMT when you document injuries, describe pain locations, providing verbal reports. They really allow for precise communication about where things are located on or in the body and how they relate to each other. So let's consider a trauma patient. If you say the patient has pain in the lower left part of the abdomen, so that is helpful. But if you say the patient has tenderness in the left lower quadrant, it's clearer, more concise, and really matches the language used by all medical providers. So that's really the value of knowing and using anatomical direction and movement terminology. So we use these terms to describe, right? So where an injury is located, whether something is on the front, on the back, the side, is it deep within the body? How pain or symptoms travel. So radiating chest pain, which might extend from the center of the chest to the left arm or the jaw. How body parts relate to one another, like whether one structure is above or below another, or closer to the trunk of the body. This section will walk you through a set of paired and positional terms, okay? So you can confidently describe what you see and feel in a way that other medical professionals will immediately understand, okay? That's the whole point. So now let's go ahead and break down some more frequently used directional terms in the field of emergency medicine. These terms often do come in pairs, and they're going to be opposites. So they're going to be opposites that describe the location of one body structure in relation to one another. Okay, it's very, very useful. They're essential for ensuring your descriptions are accurate and universally understood. So here are some of the key pairs. So right and left, okay? And when we're talking about this, again, we are always referencing the patient's right and left, not your right and left, okay? You have superior and inferior. Superior means closer to the head, and inferior means closer to the feet. An example, the chest is superior to the pelvis, and the knees are inferior to the hips, okay? Again, this is just to help you conceptually understand. You have a lateral and medial. Lateral means farther from the midline, while medial means closer to the midline. So a laceration on the outer thigh is lateral. One on the inner thigh would be considered medial. And then we have proximal and distal. These are used for when referring to structures of the limb. Proximal means closer to the trunk of the body or closer to the point of attachment, which again, we're going to talk about our shoulders being the point of attachment and our hips being the point of attachment. And distal means farther away from the trunk or farther away from the point of attachment. So the elbow is considered proximal to the wrist, and the fingers are distal to the shoulder. Okay, again, those are just random examples. Superficial and deep. Superficial refers to something nearer the surface of the body, like an abrasion. Deep describes something farther below the skin surface, such as a puncture wound or a deep laceration. These terms provide clarity when you're assessing and, again, just communicating your findings. And that's what this whole chapter is about. So instead of saying the patient has a cut on the side of their arm near their shoulder, you're going to say there's a superficial laceration on the medial proximal portion of the left upper extremity. So again, it is more of a mouthful, but it's so much more accurate and clear when you're describing it. So it's really going to reduce the risk of any misunderstandings and ensure a continuity and consistency in the care as the patient transitions throughout the entire healthcare system. So now let's go ahead and move more to location-based terminology. So we're going to look at terms like ventral, dorsal, palm. So again, let's go ahead and move on into directional terms that are going to describe very specific areas of the body. So terms that will especially be helpful when documenting assessments or explaining physical findings to other healthcare providers. First, we have ventral and dorsal. Not widely used nowadays, but still relevant. These terms are similar to anterior and posterior, but they're rooted in more embryological development and are still used in clinical language. But again, in the pre-hospital setting, you're probably going to hear anterior and posterior a whole lot more. Anterior is referring to the front, posterior is referring to the back. And on the same side, ventral refers to the belly side, again, front side, and dorsal is referring to the back, okay? A great way to remember this is to think of a dolphin's dorsal fin. It's on the animal's back. Next, we have palmar and plantar. Palmar describes the front region of the hand, so the palm. These terms, and then plantar is referring to the bottom of your foot, okay, the sole of your foot. So these terms are crucial when describing injuries to the hands and the feet. For example, you wouldn't say a patient has a wound on the bottom of the foot. Okay, you would document it as a laceration to the plantar surface of the right foot. Okay. Finally, we have apex, which refers to the tip or pointed end of a structure. In medicine, we often talk about the apex of the heart, right? So, which is located actually at the inferior portion of the left ventricle. So, down and to the left in the chest, okay? It's important to know that this term, when describing heart sounds or identifying landmarks for assessments like auscultations. So understanding and using these terms, they're really going to give you a greater accuracy and just a sense of credibility when describing patients' injuries or conditions. So instead of using vague or overly simplistic language, you're able to convey exactly what you mean using professional anatomical terminology. So now let's go ahead and move on into to movement terms. Okay, so the other movement terms, or directional pairs rather, these terms help us describe a structure's location, again, relative to one another. And it's really based on the vertical orientation within the body. So you'll use them frequently during patient assessments and when explaining where injuries are or abnormalities are located. Superior means closer to the head. So anytime a body part or an injury is located above another point of reference, it is described as superior. Example, the chest, again, is superior to the abdomen. On the other hand, inferior, that means closer to the feet. So in that same comparison, the pelvis is inferior to the chest. So this becomes important when documenting findings, communicating over the radio, and let's just say your patient has a wound located just above the belly button, right? So you could describe it as being in the superior peri-umbilical region, which is more specific and clinically appropriate description than simply saying above the belly button. Okay, so superior and inferior are also used to describe the position of injuries or anatomical structures within the head or the torso. For instance, the xiphoid process is inferior to the sternum's manubrium, while the eyes are superior to the mouth. Using these terms correctly, it really is going to help ensure clear communications with other providers, especially when transferring care to the hospital. It's just going to remove the guesswork and provides an immediate understanding of where to look and what to expect in our next, or what to expect. So now let's go ahead and move on to more just directional pairings, medial and lateral. Okay, so again, these terms describe how close or far a structure is in relation to the midline. Okay, and the midline itself is the imaginary vertical line that's going to divide the body into equal left and right halves. Medial means closer to the midline. If a wound is located near the inner thigh, closer to the groin, you would describe it as being in the medial aspect of the thigh. On the other hand, lateral means farther from the midline. Okay, so if you have a patient with a contusion on the outside of the arm, it's going to be located on the lateral aspect of the upper extremity. Okay, so these terms really help provide precise spatial orientation, especially in trauma care where you need to clearly describe injury locations. So like imagine assessing a patient with multiple wounds on the same limb. One is near the inner side of the arm, the other is on the outer edge. You'd say to the patient has a medial wound near the antecubital fossa and a lateral laceration over the deltoid. That level of precision ensures that everyone on the care team knows exactly what you're referring to. It's also helpful when you're documenting where to check for pulses, skin signs, or just tenderness. Okay, so example, the medial malleolus. So that's the bony prominence of the inside of the ankle, right? So it's the distal part of your tibia. It's an important landmark when you're assessing the circulation of an injury, right? So because we're going to check your little tibialis posterior artery or pressure point. So now let's go ahead and keep it moving. Let's go to proximal and distal. So these two terms are particularly important when describing locations just on the extremities, so your arms and your legs. These words allow us to specify where something is located in relation to the point where the limb attaches to the trunk of the body. Proximal means closer to the point of attachment, typically the torso. For example, the elbow, again, is proximal to the wrist because it's nearer the shoulder. the point where the arm attaches to the body. In contrast, distal means farther from the point of attachment. So the fingers are distal to the elbow, because they are further away from the torso along the limb. Right? So these are terms that are essential in trauma care when you need to describe injuries, pain, or abnormalities on the limbs. Like another example, if a patient has a deformity halfway between the knee and the ankle, you might document it as a distal tibial deformity or an injury to the distal lower leg. If there's a burn just above the knee, it would be proximal to the patella. So you'll use these terms when performing patient assessments. Think about pulses. The radial pulse is distal to the brachial pulse, and the dorsalis pedis pulse is distal to the femoral. Right? Understanding proximal and distal really helps you track circulation, nerve function, injury progression from like one part of the limb to another. So again, all of this plays a role, and it's all very important. And again, it all comes down to having appropriate, effective, clear communication amongst all medical providers. Moving on, let's talk about superficial and deep. Again, this is going to be essential language when you're describing the depth of an injury or structure in relations to the surface of the body. Okay, so these terms come up frequently in trauma assessment, wound documentation, and even in your initial patient impression. So superficial means closer to or on the surface of the skin. So this includes injuries like abrasions, minor lacerations, contusions. An example of this would be a patient scrapes their knee on the pavement, right? So they have superficial abrasions. The top layer of the skin is affected, but the deeper tissues remain intact. On the other hand, you have deep. Okay, so this means further inside the body or the tissues, or you can say away from the skin. So deep injuries often involve muscles, blood vessels, or internal organs. Like an example, a deep laceration from a knife wound may involve more than just the skin. It could extend through the subcutaneous tissue and the muscle. So in such cases, it's really not just a skin injury. It requires a completely different level of intervention and urgency. So these terms are helpful when describing pain locations, tenderness. A patient might say they have pain that feels deep in their chest, indicating something beyond just the surface, like a cardiac or a pulmonary event, as to like a superficial bruise. So using the correct terms really helps your team anticipate what equipment they might need, right? What interventions are appropriate and how urgent the situation is. So saying superficial bleeding, it really suggests that basic wound care may be sufficient, right? But saying a deep puncture communicates that the internal injury is possible and advanced care might be necessary. Moving on, let's go to ventral and dorsal. Again, we already hit on this a little bit, but we're just kind of diving deeper into it and for the repetition. So again, this is going to describe front and back. Okay, so these terms are really especially useful when discussing anatomy, injuries, physical exam findings, and they serve as alternatives to the more common used terms, again, anterior and posterior. So ventral, again, as we talked about, refers to the belly side of the body. It corresponds with what we typically call the anterior surface. So if a patient has pain on the chest, the abdomen, front of the legs, it's located on the ventral aspect of the body. So when documenting or reporting, you'd use ventral abdominal tenderness, okay, or anterior abdominal tenderness. It's just a more formal way of describing pain on the front of the abdomen. Again, on the flip side, dorsal refers to the back side of the body, and again, it's what we often call the posterior surface. So think of the spine, the shoulder blades, or the back of the legs. One easy way to remember this term is by picturing a dorsal fin on a dolphin. It's located on the dolphin's back. So the same idea applies to the dorsal side of the human, or the human body, rather. It's also helpful to know that dorsal can refer to the back of the hand, while palmar refers to the front of the hand, okay? So if someone has a laceration on the back of the hand, you would simply document it as a dorsal hand laceration. Using these terms correctly ensure that there's really no ambiguity in your documentation, your communication, and instead of saying the injury is on the back, you'll be able to describe it as like a 4-inch laceration on the right dorsal thoracic region. Okay, so it's just so much more clear and professional. So now let's keep it moving. So also referring to body orientation, again, these pairs are often used interchangeably in clinical language. So when we're talking about dorsal and ventral, anterior and posterior, okay? Anterior and posterior tends to be more common in modern medical documentation, while the ventral and dorsal is kind of just the standard for anatomy and certain specialties. Anterior refers to the front of the body, just like ventral. So when you document that a patient has anterior chest wall tenderness, you're referring to discomfort on the front of the chest. Okay. You might hear this used in trauma settings when describing where to apply EKGs, right? The actual leads on the chest, assess for bruising or identify seatbelt marks. Posterior, like dorsal, refers to the back surface of the body. Yeah, so if a patient has back pain after a fall, you might describe it as posterior lumbar tenderness, right? It all depends on where it is. And we're performing a back assessment, especially when checking the spinal step-offs or flank bruising. You're focused on the posterior aspect of the body. So you might be asking, why does this matter, right? Why does it matter so much? It really matters because in emergency care, right, precise language is going to eliminate the guesswork, okay? So instead of saying the injury is on the front, you say anterior thigh contusion. Instead of saying pain is in the back, you describe posterior cervical spine tenderness. So these terms communicate clearly where to assess, treat, and document. So understanding the symptoms, right? Understanding these symptoms also help when transitioning between the pre-hospital care and simply the hospital setting. When providers may prefer one set of terms over another. So you really need to be fluent in both. So which elevates your professionalism and ensures continuity of care. Now, to reemphasize plantar and palmar, right? So again, these terms used frequently when describing injuries of the hands and the feet. Okay, hands and the feet. They provide a level of anatomical accuracy that a simple description like front, bottom, it doesn't correlate, right? It doesn't match. Palmar refers to the palm side of the hand, the side that used for like a handshake, right? Whether you're describing burns, lacerations, or areas of sensory loss, referring to the palmar surface adds precision. For example, if a patient suffers a thermal burn while they grip a hot object, you would document as a you would document as a partial thickness burn to the palmar surface of the right hand. Again, it depends on the severity of the wound. Plantar describes the bottom of the foot. So this is particularly important when assessing patients with diabetes, where foot wounds can be dangerous and easily be overlooked. So if a patient has a puncture wound over, from stepping on a nail, right? It's not easy or it's not enough to just say a foot wound, right? Instead, you note a puncture wound on the plantar surface of the left foot, right? So you guys got to be more detailed. So these terms, again, help ensure you're speaking the same language as a physician, a nurse, a paramedic, a specialist who again will later treat that patient. It's going to prevent confusion and it's ensure your documentation accurately reflects your assessment. One common mistake to avoid, don't confuse dorsal and plantar, okay, when describing the foot. The dorsal surface is on the top of the foot and the plantar surface is on the bottom. If you get these wrong, and you would misdirect clinical attention to the wrong location. And again, this is going to be an error that's going to delay care. Now moving on, let's go. And I'm back. So next up, we're going to talk about another important anatomical term, and that is apex or apices, the plural version. So the apex refers to the tip or pointed end of a structure. And you're going to encounter this most when we're referencing the heart and the lungs. So let's go ahead and start with the heart. The apex of the heart is actually located on the inferior portion of the left ventricle. So it's really like near the fifth intercostal space, mid-clavicular line on the left side, okay? If the in this area where you'll most likely clearly hear what we call the point of maximal impulse during auscultations. So when we're doing an apical pulse, this is where you would put your stethoscope, okay? But in your cardiac assessment, noting any changes at the apex can provide some critical information, such as identifying abnormal heart sounds or determining the presence of a displaced PMI, which may suggest cardiomyopathy, so the enlarged heart, or other structural changes. Now, it's not super common for EMTs to be doing full-on cardiac heart tone assessments, but it is relevant information. In your respiratory assessments, you're going to learn the term lung epices. It's used to describe the uppermost region of the lungs near the collarbones. So when performing a lung exam, it's important to listen to both the apices, the bases, and the mid-lungs to identify really any abnormalities such as diminished breath sounds, any adventitious sounds like localized crackles. A patient with tuberculosis, for instance, may present with findings in the lung epices. So although the apex refers to a specific point, it carries significant diagnostic value. So whether you're auscultating, palpating, describing findings, using the term apex helps narrow down the anatomical focus, and it really communicates exactly where the problem is or where it isn't. So now let's go ahead and move on to and shift our focus to movement terms, which describes how joints, how limbs in relation to the body's midline. So in terms of how they move. These terms are essential for physical exams, especially during trauma assessment or when you're evaluating any type of musculoskeletal kind of complaint. So when you're assessing what we call range of motion, documenting neurological function or describing how an injury occurs, these words gives your observations precision and clarity. So let's start with flexion. Flexion is referring to a bending of a joint. See, it's going to decrease the angle between the two body parts. Okay, so this would be flexion. Okay. An example that's commonly used is if you look at your knee or your elbow, those are what we'd be calling hinge joints, and those do flexion and extension. So when a patient brings their forearm towards their upper arm, they're going to be performing what we call elbow flexion. And the opposite of that is extension. So if we're in this area and then we go outwards, that's going to be extension. So it's really straightening of the joint, or rather you're increasing the angle between two bones. So when a patient moves their leg from a bent to a straight position, they're extending the knee. Next we have adduction, so adduction, which refers to the movement towards the midline of the body. Think of a patient bringing their arm down to their side, okay? That is called shoulder adduction, okay? Similarly, moving a leg inward after lifting it to the side is adduction of the hip. Abduction, abduction, on the other hand, it means movement away from the midline. So like raising the arms from the side specifically and out, or stepping a leg away from the body. So that would be abduction. These movement terms help you describe really not just the range of motion, but also the mechanism of injury or any functional deficits. Okay, so an example, if a patient is unable to abduct their arm after a shoulder injury, that finding may suggest a possible rotator cuff tear or maybe even a dislocation. Now, so in the field, using these precise movement terms like these ones enhance the accuracy of your documentation, improves clarity, and again, it's going to assist with your hospital your hospital handoff. As we expand, other directional vocabulary that we can focus on is bilateral and unilateral. Again, we hit on a little bit, but these are really essential descriptors essential descriptors, especially in EMS, where time is limited and comparison plays a major role in your assessment. So bilateral means that a structure or condition is present on both sides of the body. For instance, if both lungs are expanding equally during respirations or ventilations, we describe the patient as having bilateral chest rise. Similarly, if we have a patient that has equal and strong pulses in both feet, we're going to document that as bilateral pedal pulses are present and equal. On the other hand, unilateral means something that only occurs on one side of the body. So let's say your patient is experiencing weakness in just one arm or just one leg. That would be a unilateral motor deficit. And it could be a key indicator of a stroke or other neurologic condition. So it's like let's say if one pupil, like when you're assessing pupils, if one pupil reacts to light, that is a unilateral pupillary response. So it's a big red flag for a possibility of increased intracranial pressure or some type of trauma to the head, neck, or spine. These terms themselves are especially useful when performing comparative assessments, which are like vital in our pre-hospital setting. They help you establish a baseline. So it helps you establish a baseline, identify any asymmetries, and again, communicate exactly where a problem exists. So if like a patient has diminished breath sounds on only the right side, documenting it as unilateral decreased breath sounds on the right directs attention and care to that specific area. Also keep in mind that some anatomical structures are naturally bilateral, so such as your lungs, your kidneys, your limbs. When only one side is affected, it becomes more clinically significant, and documenting it clearly using these terms is imperative. Okay, so moving on. Now let's discuss anatomic positions. Okay, so these are terms that describe posture or body orientation of a specific patient. These are used throughout EMS not only to determine how they should be transported or assessed. Knowing and using these terms really help you communicate with clarity, precision during documentation, radio reports, handoffs. So let's go ahead and start with the prone and supine. Okay. A patient is in the prone position when they are lying face down. Okay, so this is less common in EMS transport, but it's important when describing how a patient was fined or in cases involving certain trauma scenarios, such as back injuries or tactical situations. In contrast, supine position means the patient is lying face up. This is kind of the standard position for transport in most medical and trauma scenarios. Supine positioning is also the default posture used when performing CPR, airway management, or spinal immobilization. Another important position is called Fowler's position. So this describes a semi-reclining posture where the patient is still sitting upright, but in a kind of a reclined position. So Fowler's position helps improve ventilation, oxygenation, and especially in patients with experiencing respiratory distress. It also aids in the overall comfort if the patient is having abdominal pain and in certain conditions. So by default, to say Fowler's position is kind of assume that the patient is sitting upright, about a 45 to 60 degree angle. But you're going to learn shortly that there are variations to this position, such as semi-Fowler's and high Fowler's, which further specify the angle in which the patient's torso is positioned. So being able to document and describe exactly how a patient is positioned ensures consistency in care, helps others understand the mechanism of injury, and improves the safety during transport. So let's keep it going and let's kind of talk about those variations of the Fowler's position. So we have semi-Fowler's and we have high Fowler's. So these terms describe not just that the patient is upright, but how much are they upright. So it's really important detail when managing respiratory distress, cardiac issues, and again, overall patient comfort.
The semi-Fowler's position refers specifically to a patient who is reclined to about a 45-degree angle. So this is going to be one of the most commonly used transport positions in EMS, especially for patients with shortness of breath, nausea, abdominal discomfort. It allows for easier expansion of the lungs while minimizing the pressure on the abdomen. Then we have high Fowler's position. This is where the patient is going to be sitting at close to a 90-degree upright angle. So they're going to be straight up. This is often the preferred posture of patients with severe respiratory distress, such as COPD, congestive heart failure. Sitting the fully upright allows the maximum use of accessory muscle use and optimizes the diaphragmatic movement, okay, which can help improve oxygenation during your pre-hospital management of the patient. So use these position terms to really help communicate more than just the patient is sitting upright, right? Saying the patient is in the high Fowler's position with accessory muscle use tells the receiving team that the patient is upright and is just struggling to breathe. So this is going to prompt them for immediate attention to the respiratory support upon arrival. So these distinctions also guide how to secure the patient for transport. In high Fowler's, you'll need to monitor airway patency and make sure straps are positioned for safety without impeding any type of breathing issues. In semi-Fowler's, patients may tolerate oxygen mask or other devices better while maintaining a safe and relatively comfortable position. So with that, you've now really completed the core directional positionals, the directional, the positional, and any type of movement terms you'll use in everyday EMS. But again, reference the textbook because it just has long lists of these terms and definitions because there are things that you're going to have to memorize. So now that you understand the components of medical terminology, a lot of the nuances, let's go back a sec and look again at the prefixes, the word roots, suffixes, and combining vowels. So it's time to put that knowledge into practice by breaking some terms up, okay? So this process is one of the most valuable tools, again, you're going to use in EMS to quickly interpret unfamiliar or complex medical language, whether it's on a report, during a radio call, or again, just having a conversation with the hospital staff. So when you encounter a medical term that you don't recognize, the key is to break it down into a specific order. So it's important. I would always start with the suffix, okay? And that's going to be the end port. This typically tells you the action, disease, and condition. Then you look at the prefix. It's going to set the stage, giving your location, intensity, time. Then finally, look at the identified root word, okay? These will reveal the body part or the systems involved. For example, let's take the word nephropathy, okay? So if you know that pathy means disease and nephr relates to the kidney, you can determine that the nephropathy means disease of the kidney. Okay, so you don't have to memorize every possible medical term out there. You just have to understand how to deconstruct them using this specific strategy. So this approach not only helps you learn like new terminology faster, but it's also going to build confidence when you're reading hospital charts, medication lists, or listening to complex handoffs in these like real high stress, high fast, high staked environments. So now let's go ahead and move on. Let's take our example and kind of like break it down. Okay, so again, this is a perfect illustration of how the medical terms can be deciphered by using part by part method we just covered. Okay, so again, suffix. Again, we just talked about it, but this time now we can actually see it broken down. So the suffix pathy. Okay, this is going to mean disease. Knowing this already tells you that the term refers to some form of pathology, right? Next, identify the combining vowel. So this, in this case, it's going to be a no. It's not that it's going to add any type of meaning. It's just there to make the word easier to pronounce and connecting the root to the suffix smoothly. Now, let's look at the word root. Right, so we're going to look at nephr. Which refers to the kidney. The root shows up in many terms involving the renal system, like a nephrologist, right? So it's a kidney specialist, or a nephrectomy, surgical removal of the kidney. But let's look at this guy. So when you put it together, nephr, kidney, O is your combining vowel, pathy is disease. So we get nephropathy, disease of the kidney. This kind of breakdown, incredibly useful. Again, if you hear, like another example, if you hear that a patient has a diabetic nephropathy, you know that immediately that their diabetes has affected their kidneys, right? A crucial piece of information when considering fluid administration, blood pressure management, or just medication clearance, like to get that medication out of their body. So let's keep this practice going. Let's look at dysuria, okay? So this is another excellent example of how we can decode a word by just examining the different parts, okay? So as always, let's look at the suffix, ia, okay? So ia, which means a condition of. This tells us that we're talking about a state or a symptom, okay? So some alteration in normal function. Now let's look at the prefix, dis. Very common prefix in medical language. It means difficult, painful, abnormal. So you're going to see this prefix in many other words like dysphagia, difficulty swallowing, dyspnea, difficulty breathing. So, and here the root word is ur, okay, which refers to urine or the urinary tract, okay. So you'll encounter this specific root word in terms like urinalysis, urethra, or urinary tract infection. Okay, but now let's put it all together. Dis, difficulty, or painful, right? That's going to be your prefix. Your word root, ur, means urine in this case, and then your suffix ia, condition of. So the term dysuria translate to a condition of painful or difficult urination. Okay, so this is a symptom you'll frequently encounter in the field, especially in our elderly patients or those with some type of UTI. But being able to recognize and understand a term like this allows you to better document findings, relay symptoms to hospital staff, to providers, and again, just interpret physician instructions even more quickly. Let's look at another one. Hyperemesis, okay? So this is especially common in cases involving gastrointestinal illness, pregnancy, toxic exposure, and just understanding what it means helps you assess severity and prioritize treatment. So again, so if we look at the prefix in this one, hyper, okay, which means excessive or above normal, okay? So this is a powerful prefix that immediately alerts you to a situation involving increased activity, increased intensity, or increased quantity. So like in hypertension, that means high blood pressure, or hyperthermia, elevated body temperature rather. Then we have the word root, emesis. So this is going to refer to vomiting, okay? You'll also hear this in terms like antiemetic, which is a medication given to control nausea and vomiting. But let's look at hyperemesis, all right? So let's break it down. The prefix hyper means excessive. The word root emesis is vomiting, okay? In this case, there's no suffix. So we get hyperemesis, which means excessive vomiting. So this term is more than just descriptive. It has a significant clinical implication, right? So excessive vomiting can lead to severe dehydration, electrolyte imbalance, hypovolemia, or hypovolemic shock. So it's particularly serious in like your pregnant patients, where the term hyperemesis gravidum is used to describe a pregnancy-related condition that may require IV fluids, hospitalizations. So recognize the terms really help you act faster. So if a patient says, "Hey, I've been throwing up nonstop for 2 days," you can document that as hyperemesis. So that means what? That means you need to assess for dehydration and really start preparing for appropriate supportive care during your transport. Let's look at one more. Let's break down a term you'll see often, again, in medication lists and pain management protocols, analgesic, okay? So understanding this word gives you insight into both the function of a drug and what it is being used to treat. So let's go ahead and break it down from the suffix, right? So ic, so ic, which means pertaining to. So this is a common suffix that turns a root or compound into an adjective, describing what something is related to. Now to the prefix an, so an, which means without or absence of. So the prefix shows up in many medical words where describing something that is lacking, like anoxia, lack of without oxygen, anemia, without enough red blood cells, or anesthesia without anesthesia without sensation. So the word root here is alges, okay, which refers to pain. Okay, so you'll also see the root in analgesia, absent of pain, and hyperalgesia, increased sensitivity of pain. Right, so there's so many different terms, but as long as you break down and start understanding and memorizing word roots, prefixes, and word roots, suffixes, prefixes, and word roots, you're going to be able to kind of master this language. So you don't necessarily have to memorize hyperalgesia, that specific term means this. You should focus more on memorizing the individual parts, right? So if we put this one together, we have our prefix an means without, alges means pain, and ic means pertaining to. So analgesic means pertaining to the absence of pain, or more commonly, a medication that relieves pain. Okay, so this term applies to really a wide range of drugs, from over-the-counter medications like acetaminophen, ibuprofen, to stronger agents like morphine or fentanyl, okay, which may be administered in the pre-hospital setting. So knowing what an analgesic is and being able to explain or document it accurately is key to good patient care and really effective communication with that receiving facility. So now that you've practiced decoding full terms using real clinical examples, we'll shift to our final section on abbreviations, acronyms, and symbols. Okay, so this is the shorthand of medicine that can either speed up communication or lead to dangerous misunderstandings if they are misused. So now that we've covered how to build it and break it down, let's look at our commonly used abbreviations, acronyms, and symbols. Okay, so these tools really can make documentation go so much faster, right? But only when you're used accurately and correctly and utilizing the common ones. Okay, because misusing them can lead to real dangerous misunderstandings. So in EMS, we operate really in fast-paced environments where efficiency is the essential aspect here. Instead of writing or saying cardiopulmonary resuscitation, we'll just say CPR, right? Rather than documenting shortness of breath every single time, we can use and just write SOB. So these shortcuts really allow us to communicate large amounts of information quicker, right? But it's vital that everyone involved knows exactly what terms mean. So one major warning here, do not sacrifice accuracy for speed. So abbreviations must be clear, commonly accepted, and understood across your agency or region, right? So for example, while MI is widely recognized to mean myocardial infarction, so a heart attack, an unfamiliar or homemade abbreviation might be like NTI for not taking insulin. So this could confuse another provider and affect the patient care. Also be aware that some agencies will place strict limits on what abbreviations can be used in documentation. This is especially true in electronic charting systems where misinterpretations can lead to coding errors, billing issues, or even legal complications. So in these final two slides, we're going to really explore how to properly use abbreviations and symbols, and what to avoid, how to ensure shorthand is safe, effective, and just overall professionalism. So let's look at specifically the abbreviations and acronyms. And there's so many in the medical field because, as I stated, it helps to relay a large amounts of information in smaller terms, but also it's going to be a way for you to help memorize things. So let's look at two distinct forms here. We have shorthand used that's what these abbreviations and acronyms are. They're essentially just shorthand communication. So in EMT, you're going to use both of these fairly regularly, especially in your patient care reports, your handoffs, and your radio reports. But again, the key is to use them safely and appropriately. Okay, an abbreviation is any shorthand form of a word or phrase. For example, BP. That stands for blood pressure, or HR for heart rate. So these types of abbreviations are really universally known and understood in healthcare. And it's going to save you time while preserving the clarity. While an acronym, on the other hand, is formed by taking the first letter of each word and in a phrase and pronouncing it as a word. A great example you guys is going to learn is sample. Okay, and this is going to be a part of your secondary assessment. So this stands for, and we're going to go down the list of SAMPLE, signs and symptoms, allergies, medications, pertinent past medical history, last oral intake, events leading up to the illness or injury. Okay, or you might see something like DCAP BTLS for trauma assessments, or ABPU describing someone's mental status. So acronyms like these are built into your patient assessment process and ensures that no step is missed. However, again, not all abbreviations are really created equal. So it's really essential to only use abbreviations that, again, are widely accepted and approved. So even common abbreviations can vary slightly between hospitals, EMS systems, specialties. For instance, PT. That might mean patient to you and me, but to a nurse, it might mean physical therapy. So always keep your audience in mind. Another point, be cautious about overusing abbreviations in documentation. While it's fine to write like, BP, BP 130 over 80, HR 78, RR 16, the vital sections, in the vital section, avoid writing something like, PTW slash, then an upward arrow HR and downward arrow BP, contact ALS, because that might save time, but it can come across as sloppy, unclear, especially when it could be under legal scrutiny. Okay, and again, the textbook has so many good abbreviations and symbols, so it's good to be aware of them. But again, when you start working in the field, just be aware of what ones are more commonly used. Because again, it might be in your textbook, but not everyone remembers every little symbol to use. So again, only use the ones that are universally accepted and known and specific to your region and department. So now, I could have put a lot of symbols here just to show you, but in your textbook, you're going to look at a lot of different symbols, okay? So symbols are like simple marks that can pack a lot of meaning into like a tiny space. So you'll see symbols frequently in patient records, field notes, even on medication labels. They can be incredibly useful, but like abbreviations, they have to be used with caution to prevent miscommunications. Some symbols are fairly intuitive and widely recognized. For example, an upward-facing arrow indicates increase, right? So like an upward arrow and BP, elevated blood pressure. Okay, I don't love that because I'd like you to actually write in what the blood pressure is, but it's fine. Or a downward arrow and LOC, so decreased level of consciousness. Another common one is using the symbols for male and female. So that's fairly common as long as you kind of remember, but it's like a little circle with an arrow or a circle with a T or cross indicates, male or female. A big R or a big L represents right or left. A positive sign, like a plus sign in a circle, that means what they're positive for, nausea, positive for, headaches, things of that nature. And on the flip side, the negative sign in a circle, again, they are without nausea, without headaches, things of that nature. So again, while these symbols are convenient, again, I recommend reading the textbook just so you can see like the vast amount of different symbols. So again, as they are convenient, again, they're highly vulnerable to misinterpretation, especially again if you're used inconsistently or without clear context. Okay. So an example, like using a slash mark. So this could be misunderstood as or per or just a line separator. Even the common abbreviation of U for units has been misread as 0. So leading to a tenfold dosage error. Like there's a lot of situations there, and that unit thing is going to be more of like insulin. Okay, because again these risks. Because of these risks, organizations like the Joint Commission, the Institute of Safe Medication Practices, they've published a whole list of do not use for certain abbreviations and symbols. So I would recommend kind of like sifting through that. Again, through this whole chapter, it's all about learning this new language of medicine. Okay, and that's kind of your job. And it's an active participant job. Okay, so you need to actually focus on it and get better at it and get and to develop those skills. Now, in the field, you're going to start learning them as you start working because they're just going to be like you're going to use them a lot more and you're going to see them a lot more. But it should start now. It should start you to actually focus on them. And you're going to, when we do patient assessments, you're going to have to do like patient narratives, and I expect you to utilize those common abbreviations and symbols again that are approved. approved. So again, at the end of the day, what is your takeaway from this specific area? Use symbols like sparingly and only if they're approved in your documentation protocol. When in doubt, just spell it out. Okay. Your report may be referenced in court, reviewed by a physician, or handed off to a nurse that's just unfamiliar with your shorthand. So you should always, again, prioritize clarity over convenience. So by mastering not just medical terms, but also how to use abbreviations and symbols safely, you're building a foundation of professionalism, safety, and trust. And really that matters because your words, whether written or spoken, directly affect the care a patient will receive. So again, this whole chapter is all about medical terminology, learning that new universal language of medicine, and it's vitally important when you're trying to have a continuity of care. Okay, so with that being said, that's the end of this presentation. I will see you next time.